As a doctor, I often hear patients complain about nighttime bathroom trips, or nocturia. This condition involves waking up one or more times at night to urinate. It disrupts sleep and may signal underlying health issues. Nocturia can stem from various causes, from excessive fluid intake before bed to more serious conditions like diabetes, kidney issues, or prostate problems in men. Did you know your body has a natural mechanism to regulate urination? The antidiuretic hormone, ADH, produced at night, reduces urine production to help you sleep soundly. However, with age or certain conditions, this mechanism can weaken. For instance, older adults often have lower ADH levels, leading to more frequent nighttime urination. Recent studies, such as one published in Journal of Urology, 2023, show that nocturia is more common in people with deficiencies in nutrients like vitamin D and magnesium. These nutrients play a key role in regulating bladder and kidney function. In this 7-part series, I'll explain, as your doctor, how proper nutrition and vitamins can reduce nighttime bathroom trips. Let's start by understanding what's happening in your body when you wake up at night. Vitamin D isn't just the sunshine vitamin for strong bones, it's critical for bladder muscle function. A 2024 study in European Urology found that low vitamin D levels are linked to overactive bladder, which can cause nocturia. Why does this happen? Vitamin D regulates calcium metabolism, which affects muscle contractions, including the detrusor muscle in the bladder. A deficiency can lead to uncontrolled muscle contractions, triggering nighttime urges to urinate. Additionally, vitamin D has anti-inflammatory properties that reduce irritation in the urinary tract. How can you check your vitamin D levels? Ask your doctor for a 25-hydroxyvitamin D test. A normal range is 30 to 50 nanograms per milliliter. If your levels are low, consider adding fatty fish, salmon, sardines, eggs, or fortified foods to your diet. You may also discuss supplements with your doctor. However, be cautious. A 2019 study showed that excessive vitamin D can increase the risk of kidney stones. In the next episode, we'll explore magnesium, a key ally in controlling nocturia. Magnesium is a mineral rarely discussed in relation to bladder health, but it's vital. It helps relax muscles and regulate nerve signals that control urination. A 2023 study in urology found that magnesium deficiency can worsen bladder spasms, leading to more frequent nighttime urges. How does magnesium help? It reduces nerve sensitivity that triggers bladder contractions and supports electrolyte balance in the kidneys. Magnesium-rich foods include nuts, seeds, spinach, and whole grains. The recommended daily intake for adults is 300 to 400 milligrams. However, too much magnesium from supplements can cause diarrhea, which may worsen your condition. If you opt for supplements, choose forms like magnesium citrate or glycinate, which are better absorbed. Always consult your doctor, especially if you have kidney issues. Next, we'll discuss how B vitamins affect the nervous system and urination. B vitamins, particularly B6 and B12, are crucial for the nervous system, which controls the bladder. Nocturia is often linked to disrupted nerve signals that cause the bladder to contract at night. A 2022 study in neurourology and urodynamics showed that B12 deficiency can worsen neurological issues, including overactive bladder. Vitamin B12, cobalamin, supports nerve health and helps produce myelin, the protective sheath around nerve fibers. B6 reduces inflammation and balances neurotransmitters. However, there's a catch. Excessive B6 and B12 can be harmful. A 2019 study found that high B12 doses in men may increase lung cancer risk, while too much B6 can cause neurological side effects. Good sources of B12 include meat, fish, and eggs. Vegans can opt for fortified foods or supplements. B6 is found in bananas, potatoes, and nuts. Recommended doses are 2 to 3 micrograms of B12 and 1.3 to 2 milligrams of B6 daily. Avoid high-dose supplements without medical advice, as they may worsen symptoms. Next, we'll explore antioxidants and their impact on the urinary tract. Inflammation in the urinary tract can contribute to nocturia, especially with chronic infections or irritation. Vitamins C and E, powerful antioxidants, help reduce inflammation and protect bladder cells. A 2023 study in International Journal of Urology showed that vitamin C reduces oxidative stress in the urinary tract, decreasing irritation and urge frequency. It also supports immunity, which helps prevent infections. Sources include citrus fruits, bell peppers, and kiwi. The recommended daily dose is 75 to 90 milligrams. Vitamin E protects cell membranes and may reduce bladder spasms. It's found in nuts, seeds, and oils. However, high doses of vitamin E can be harmful, as noted in Annals of Internal Medicine, 2019. How to combine these vitamins? Try salads with bell peppers and nuts, dressed with olive oil. Avoid excessive supplement doses to prevent side effects. Next, we'll discuss the role of diet and hydration in managing nocturia. Diet plays a huge role in managing nocturia. Excessive caffeine, alcohol, or salt can irritate the bladder and worsen nighttime urges. Meanwhile, a balanced diet and proper hydration can significantly improve the condition. A 2025 study in Cell Reports Medicine found that high salt intake increases blood toxins, affecting the kidneys and bladder. I recommend limiting salt to 5 to 6 g daily and drinking water evenly throughout the day, avoiding large amounts before bed. Include fiber-rich foods, vegetables, fruits, whole grains, to support gut health, as constipation can press on the bladder and worsen nocturia. Also, avoid foods with antivitamins, like raw legumes, which can block B6 absorption. In the final episode, we'll summarize how to combine these tips into a daily routine. We've learned that vitamins D, B6, B12, C, E, and magnesium can help reduce nighttime bathroom trips. Here's a practical plan to put it into action. Check your vitamin levels. Get tested for vitamin D and B12 to identify deficiencies. Balance your diet. Include magnesium-rich foods, nuts, spinach, vitamin C, citrus, peppers, and B12, fish, eggs. Control hydration. Drink 1.5 to 2 liters of water daily, but reduce intake after 6 p.m. Avoid irritants. Limit caffeine, alcohol, and salty foods. Use supplements cautiously. If your doctor confirms a deficiency, consider vitamin D, 800 to 2000 IU, or magnesium, 200 to 300 milligrams, in citrate form. Consult your doctor. Nocturia may signal serious conditions like diabetes or prostate issues. Keep a diary. Track your diet, fluid intake, and bathroom trips to monitor progress. A 2024 study in urology confirms that a comprehensive approach, including diet and vitamin correction, can reduce nocturia by 40 to 60% in most patients. However, excessive intake of vitamins like B6, B12, and D can cause side effects, so stick to recommended doses. By following these tips, your sleep can become more restful, and nighttime bathroom trips can become a thing of the past. Always consult a doctor if symptoms persist.